Hi, everybody. This is Dr. G, your mad shrink. I'm a board-certified psychiatrist here to offer you information and advice about mental health and to challenge your assumptions. And today I'll be talking about achieving trance, of all things, meditation, hypnosis, and truth serum. Now, this may sound like a really exotic topic, but it's something that everybody has experienced. I'll explain. Supposing you decide to go to your neighborhood movie theater, if they still exist, and you go to a matinee, and when you enter, you're feeling this ache in your right knee that's been nagging. You feel hungry, you forget, you didn't have lunch and you forgot, and you're hungry now. But you sit down and you hear the rustling and the murmuring of the other customers. And then the movie starts, the credits roll up the screen and the action begins, and the theater darkens, and you become increasingly absorbed in the goings-on the screen. And as you do, you don't pay any more attention to the noises in the audience. You forget about the discomfort in your knee. You forget that you're hungry. And you watch the movie. And at the end, when the lights come up and you leave the theater, you're startled to see that it's nighttime. And you had no awareness that the movie had been that long. This is because you were in a trance. Or supposing you're driving on the freeway and you want to get off at a particular exit and you're watching the road and the signs, the road signs and the exit signs as they come up, but you're preoccupied with a problem at work, let's say, and you're trying to figure out how can you solve that? Should I do this? Should I do that? And while you're looking right at the road signs and the exit signs, you go right by your exit, even though you saw it because you were absorbed in your thoughts about the problem at work. And this is because you were in a trance. Or, speaking of driving, if you're driving down the road at night and you're watching very continuously the line in the center of the highway, eventually you may notice that your absorption in watching that line is having an effect on you. You begin to feel sort of woozy, or things seem to change in some strange sense as far as your perceptions go. And so you stop looking at the line and you get out of the trance that you have started going into. Or supposing that you meditate. Now, what do we do when we meditate? The usual forms of meditation, not the only ones, but the usual ones involve focusing effortlessly on a limited range of stimuli. And those stimuli could be your breathing, your breaths, just noticing your breaths, how they feel going in and out, maybe visualizing the air moving in and out of your chest and your throat and your nose. Or you may be focusing instead on a word, a mantra, or maybe an image, either in your mind's eye or on a wall. But as you effortlessly focus on the limited range of stimuli, your awareness changes, and elements that ordinarily are part of your everyday awareness drift away, and you don't pay attention to them in the same way, while at the same time you focus more intently than those other elements on the particular point that you're concentrating on in the meditation. So trance is a state that involves an effortless focus on a limited range of stimuli such that change occurs. That's an inevitable aspect of trance. In the movie theater, when I was watching the movie, I was no longer in any discomfort. I didn't hear anything around me, and I was much more focused on the screen. So trance is an everyday phenomenon. Now, there are different degrees of trance, and there are deeper degrees of trance than the everyday usual meditation. And I'll give you examples from my personal experience. A number of times over the years when I went to a dentist and I was sitting in the dental chair and the dentist was drilling away and performing all sorts of work on my root canals, extracting wisdom teeth. While the dentist was doing that, I was sitting in a waterfall pool in Tahiti, and very refreshing pool with the water cascading gently over me in a refreshing way, with the gaily colored birds sitting in the trees, parrots of one type or another, and orchids all around, and all in all, a very refreshing experience, delightful experience. And when I felt any semblance of discomfort from what the dentist was doing, the waterfall cascading on me became more refreshing and more cooling, and the pool more refreshing, and the birds even more gaily colored and singing even more beautifully. And that's how I got through the dental appointments. Another instance, many years ago, I was experiencing a crisis. I was very distressed, and I decided that I needed to see a psychotherapist. Unfortunately, there were no psychotherapists around where I lived in whom I had confidence. So I decided to find another therapist, and it was one I actually idolized and thought he would be perfect, but I couldn't go to him and he couldn't come to me. Why? Because he was dead. It was Dr. Milton Erickson, whom I referred to earlier, who was probably the greatest clinical hypnotherapist in the world and an originator, a pioneer in brief strategic psychotherapy. And I had seen a number of videotapes of his work with patients and with students, and heard a number of audio tapes. I knew what he sounded like, what he looked like, the kinds of things that he might say. And so I decided to bring him to me, and once a day for 30 minutes every day, I sat in a comfortable chair and hypnotized myself into imagining that I was having a therapy session with him. And I would say the kinds of things I would say to a therapist. He would reply, make comments, suggestions. Now and then he would actually say things to intensify my trance, like with every breath, you're feeling more and more relaxed as we continue talking, that kind of thing. And I felt better after each session, and after a week I was completely over the crisis and my distress. And so he and I terminated on the best of terms. Another example of hypnosis was with a patient I saw many years ago. He was an electrician, and he was very good at that. He took pride in his work, and he suffered from intractable vomiting that seemed related to stress. There was no apparent medical cause of it. Now, he didn't seem a particularly good candidate for psychotherapy, but he and I agreed to do hypnosis. So I induced a hypnotic trance in him, and I'll tell you something a little bit later about the mechanics, the process of trance induction. But I induced a trance in him, and I suggested to him that he construct a whole system of electrical circuits within himself, in his mind's eye, that would be able to regulate and stop his vomiting. And it was up to him. He could construct include however many toggle switches and relays and junction boxes and wires, with the purpose of being able to turn off his tendency to vomit unnecessarily. And he left, and he never had another episode of vomiting. And as far as I know, he continued to do well. Now, what is the difference between this form of trance, which hypnosis is, and the lighter forms, meditation or the everyday trance that I described at the beginning? Well, in hypnosis, although that too involves an effortless focus on a limited range of stimuli to begin with, that's how one goes into a trance and continues in a trance. It involves altered perceptions, not just simply excluding from your awareness the usual things that you're aware of, but altering them sufficiently, altering the perceptions sufficiently, so that you feel things differently in your body, somatically, or you remember things that you didn't before, or forget things that you thought you remembered, or feel yourself physically to be different in some way. So it's a deeper level of trance that involves the production of altered perception. Now, this is a process, and really all trance involves the process of dissociation, but it's particularly present in hypnosis. And dissociation is just simply what I've already said. It's an exclusion from awareness of things that are ordinarily accessible to awareness. Now, this could be an everyday phenomenon, but it also can be a manifestation of psychopathology. For example, people who feel so anxious or otherwise distressed about something that they really can't tolerate, experiencing those feelings may dissociate and feel nothing or feel numb all over. So it's a kind of protective mechanism for them. And there are more blatant examples of dissociation in psychiatric disorders. For one is what used to be called a conversion disorder. I have no idea what the DSM now calls it. I'm not big on labels. But a conversion disorder was a condition in which one completely became unaware of a major emotional conflict or source of distress, and instead expressed that through their bodily symptoms of certain kinds. For example, many years ago, I saw a middle-aged man who was going through a crisis in his life, and he suddenly couldn't walk. He was paralyzed from the waist down. He was functionally paraplegic. So I hypnotized him and helped him to integrate the source of distress. And when he came out of the hypnosis, he was able to walk. So an example of a conversion disorder. There's also a serious dissociative disorder called the fugue state. Again, I don't know what DSM-5 calls it, but that was the more traditional term for it, in which you dissociate from your awareness your entire identity. You don't remember who you are. Most famously involving people who just find themselves in places like strange cities. They have no idea how they got there or who they are. And it happens. It's been the source of some Hollywood scenarios. But I've seen a couple of people with fugue states. Also, probably best known is dissociative identity disorder, in which people exclude from awareness not themselves completely, as in fugue state, but parts of themselves, parts of their personalities, parts of their beings. And that's used to be called multiple personality disorder, now DID, dissociative identity disorder. Now, interestingly enough, the main form of treatment used to be for people with dissociative identity disorder, multiple personality, was hypnosis, hypnotherapy, which makes sense because those people are great at dissociating. They're actually skilled at it, and I don't mean that facetiously. They're generating those symptoms to protect themselves from even greater pain than that they would otherwise feel, maybe from some past severe traumas. And people who can dissociate or do dissociate, even when it's maladaptive, it's part of psychopathology, are much more readily, in general, able to experience the hypnotic state because they already are good at producing dissociation. And I've taken advantage of that with some of my patients who tended to dissociate. I taught them how to self-hypnotize themselves out of their unpleasant dissociative states. As far as the process of hypnotic induction, I'm going to suggest a scenario. It's your responsibility. You do this or not as you wish. As I've said before, I am recommending nothing to any of my individual viewers or listeners. I'm just here to tell you what other people have experienced and what's worked or hasn't worked for other people. So what you do is your responsibility. But I'll give you an inkling now about how hypnotic induction is able to occur. If you seat yourself comfortably in a chair in a quiet place and just pick a really small spot on the opposite wall to look at, so small you could barely see it, and just continue to look at it in a relaxed way, not trying to do anything, not trying to force yourself to do anything, which, by the way, is an essential when you're deliberately inducing a trance for either meditation or self-hypnosis, is that you're not trying to make yourself focused or trying to do anything. That defeats the whole person. It needs to be effortless. So you just look at the spot effortlessly on the wall and notice how eventually, sooner or later, the spot looks as if it's beginning to change. Now, most times that will happen because this is how our nervous systems are wired. If we stay with any stimulus, any continuing stimulus that doesn't vary, our perceptions change. That's true of odors, that's true of sounds, it's true of all kinds of stimuli. So you just watch the spot on the wall, and eventually it looks as if it's changing color slightly, changing its hue. Maybe the outlines of it are getting a little more blurred or more distinct. It may seem to pulsate a little or move a little bit across the wall as you're looking at it. And if one is going into a hypnotic state, or a hypnotist is guiding you into a hypnotic state, then the hypnotist will just take advantage of that. By the way, as an aside, people can become anxious, fearful about hypnosis. Oh, they're losing control of themselves to somebody else. No, you actually have more control over yourself. But getting back to this spot on the wall, the hypnotist may say something like, as you continue looking at the spot, you'll notice sooner or later that it begins to change. And as you notice that it begins to change, you can also notice that how you're feeling begins to change gradually, breath by breath. You may find yourself feeling more relaxed, feeling calm, feeling your breathing slowing. And as you notice those changes in yourself, the changes in the spot become more noticeable. And the more they become noticeable, the more relaxed you feel. And so the hypnotic induction proceeds taking advantage of normal natural phenomena and building on them, so that it's kind of a positive feedback loop. And one change produces another change, which goes back and produces more of the original change. And that's how it works. Another very common formal standard way that people have used to induce hypnosis is to just sit in a comfortable place. Don't move your head, but roll your eyes up toward the back of your head to try to see the top of your head, and hold your eyes there a little bit until there's a bit of a strain, and then just slowly take a deep breath in, let it out as you let your eyelids close. And the suggestion can be, as you let your eyes close, you'll notice that you feel a little bit like you're floating or gliding. And that's a natural aftermath of doing something where you look way up the top of your head and your eyes get a little bit strained, and then you let them close, and you feel a little bit different, a little bit sometimes off kilter, a little bit maybe dizzy, and the hypnotic induction takes advantage of that. And the more you feel like you're floating, drifting, and gliding, the more you can feel comfortable in your own chair and feel lighter or heavier or more and more relaxed with every breath. So the process of hypnotic induction just takes advantage of perfectly normal, everyday phenomena, but builds on them and creates a meaning around them. One last aspect of the trance that I want to mention is the subject of truth serum, the truth serum. And there's a lot of folklore about it, a lot of myths about it. Truth sera, plural of serum, started to be used professionally as a result of war trauma. Soldiers would come home with what we now call PTSD, and they just couldn't remember things, couldn't come to grips with what they experienced, terrible things. And psychiatrists would inject them with infusions of mainly barbiturates, sodium pentothal, sodium amytal, and to help them not only calm, but also to be rid of the kind of paralyzing anxiety that was preventing them from remembering certain things and integrating them. So in a way, the barbiturates were chemically de-repressing them, so to speak, and chemically dissociating them. So the anxiety and the tremendous distress that they were feeling somehow faded, and they were able to focus more on whatever they needed to solve. And the truth serum that made its way mostly into the movies, scopolamine, it doesn't work very well. It's been used in spy movies to force secret agents to divulge secrets and the like, and also be amnesic, which it does do, amnesic for what they coughed up in the way of secrets. But in fact, all pretty much scopolamine does is make you into a babbling mess that really you're incoherent, and what you say probably is not very useful to begin with. So the sodium amytal, though, that I referred to, I've actually done sodium amytal interviews with some patients, The original therapeutic use of it was called narcosynthesis for people with PTSD, but it can also be used when, in the past, when people have physical symptoms that may be psychologically based as a way to help them get to the bottom of it and integrate the source of the symptoms. There was one experience that I had when I was in the Air Force. I was a medical officer, and I was called upon to treat a navigator, Air Force navigator, who had flown over Vietnam and had top secret clearance and was privy to very, very high level of secret classified information. And he developed severe physical symptoms during his trip. And it wasn't clear whether they were psychologically based or not. And so I was called upon to start intravenous line and to give a sodium amytal interview, slowly inject sodium amytal. And while I did that, standing in front of the door of the closed treatment room was an armed guard, military police, who had to be there for security reasons in case the patient said anything that other people weren't supposed to hear. Fortunately, he said nothing of value whatsoever, and that's why I'm here to tell you about it. All right, so I hope that you found something of interest to you or use to you in today's podcast, and I will look forward to seeing you next time, and be well. Bye-bye.